dialysis now?
Yeah, I think so.
I think it's going to be a really good experience. I just want you to keep those things in mind as you go out and venture out on this observation.
Okay.
Hey, what's up?
Excuse me, I just wanted to get your attention for a minute because my patient I've been caring for, I just noticed in the last 4 hours they've had a low urine output of like 40 mils, so like 30 mils for the whole period. So I just want to get in touch with my nurse.
Okay. Yeah, let's do that. Let me just finish with Megan. She's going off to dialysis, and just give me 1 second.
Okay.
All right. So anyway, I hope you have a good time.
Okay.
All
Yeah,
right.
thanks.
Bye. Okay, Rob. So tell me more about your patient.
Well, they are 1 day post-op for cholecystectomy.
Oh, okay.
A 42-year-old male.
Okay.
Now I'm warning, the vital signs have been pretty stable. Heart rate and blood pressure were okay. He's on 100 mils an hour, normal saline, fluids, and the labs though that just came back. Although the creatinine was okay, the BUN was a little high. It was 40.
Oh, okay.
So.
And his urine output has been 30 mLs in the last 4 hours.
4 hours,
Okay, so
yeah.
that's significant. That's a big change. Well, you know, one of the ways we're going to communicate this to your nurse is in what we call SBAR format.
Okay.
So let's go over that and see if we can really make this information more concise, so when you communicate, you get across what you want to tell them.
Oh,
okay? So SBAR stands for situation, background, assessment, and your recommendations as an RN. And it's a really nice way to communicate with your doctors, NPs, PAs, or even the nurse that we're working with. So in this case, your S is your situation. What would you say the situation is?
Situation is a quick description of my patient, a 42-year-old male.
Yep.
And
Well, it could be that the situation is you have a low urine output.
Oh, okay.
So that's it. That's your big finding. So your situation is that thing that said, okay, I need to communicate this.
Okay.
So we'll go with that, is the low urine output. Your background is what you're talking about.
Okay.
Patient is a
42-year-old male.
Right, and he just had...
He's 1 day post-op.
Exactly. So that's the background of what's going on. So then you also gave me a further assessment, and you talked to me about the labs.
Right.
So
yes.
we're going to conclude that your assessment includes the labs, that the vital signs have been stable, okay? And you could also note, because maybe he's holding on to fluid, so you might want to note, does he have edema too going on? Or his lung sounds, are they clear? Because he's getting IV fluids at 100 mLs an hour, and he's been getting that for the last 24 hours. Plus, he got fluids in surgery.
So where is that?
So there's fluids on board. He's not urinating them out. So he might be third spacing, may or may not. So we want to definitely look at that. And then your recommendations. I thought you were spot on. You had a feeling maybe we should do some diuretics. Many times post-op patients need a diuretic. So I think that's a great thing. So do you see how this format would really help you communicate?
Yeah, it would make things a lot clearer and quicker. I
Yeah.
need to bring someone else into the picture for us.
So let's do that.
Okay, great. Hey, Deb.
Hi, Rob. How are you this morning?
I'm doing pretty well. If you're all done with meds, I'd like to interrupt you for a second.
Yeah, I've got a minute.
Okay, great. So I have something that I wanted to bring to your attention. It's about Mr. Beans over in 41. I brought it to the attention of my clinical instructor. Now what I want to do is deliver you the information in SBAR format, since that's what we just went over.
Okay.
So the situation is I have a low urine output. And the background is a 42-year-old male in room 45. He's 1 day post-op from cholecystectomy.
Okay.
Now the assessment findings have been regular heart rate, regular blood pressure, and lab values came back. BUN's a little high, creatinine's okay. As far as third spacing and edema, no signs, and lungs are clear bilaterally. So my recommendations are going to include maybe a Lasix or a diuretic into his medication regimen right now, so he can maybe increase his voiding output.
Okay, I think it's a very good assessment and a good idea. We'll give the physician a call.
All right, great.
Okay.
Sounds good.
Okay,
Thank you.
you're welcome.